Hi, I'm Dr. Edgar Cyril, known as a podiatrist of Corrective Step in Tigard, Oregon. Just playing some basketball, and of course I got the dames. Unfortunately, I landed on someone's foot and I rolled my ankle. I'm gonna teach you how to treat an acute ankle sprain. So I made it home. I guess let's do a little background. I was playing basketball, pickup, and unfortunately going for a rebound, jumped up and rolled on somebody or landed on somebody's foot and rolled my ankle. Ankle sprain. I feel most of the pain on top here and towards the outside. So in terms of putting weight down, it's pretty hard. So we're going to practice price. For those of you who don't know, price is protection, rest, ice, compression, and elevation. So first things first, protection is stop the aggravating factor. So I stopped playing basketball. Rest is hopefully obvious, means that I'm not going to be walking, I'm not going to be moving around, I'm going to be staying off my ankle for the time being. Ice. There's a lot of different types of ice packets out here. We have some as well too. You can see our office's ice packs. You can also put ice in a Ziploc baggie, or there's pre-made ice packets as well too. In the bind, you can also use some food ice, some chin chin that you can use. Basically, you want something like peas or corn that can basically get into smaller areas. So the important thing is you don't want to put ice directly against your skin. You want to make sure that you have some sort of barrier in between you and the ice pack. So I have my sock on, going over the area, pack on for about 10 to 15 minutes. Any less, you may not get in as much of the therapeutic, anti-inflammatory, and pain reduction. Too much, and you might be getting the exact opposite in terms of vasospasm of your vessels and increased swelling and increased pain. After I get done icing, we're going to put a nice little compression sleeve or brace on there. There's different grades, and we'll talk about that in a little bit. Stay tuned. Okay, 15 minutes has been up. One thing I did not mention earlier, you do want to start, you actually start to feel the coldness. So if you're wearing a barrier, such as a sock or even a blanket, it doesn't make sense to start the timer if you don't start to feel the coldness. So now that the 15 minutes is over, I'll take this off. And mention is also elevate. That's part of price. So my foot obviously is elevated at this, my ankle is obviously elevated at this time. Hi. So later in the day, and guess what it's time for? That's right. It's time to ice and elevate. So again, this is going to go over my ankle for about 10 to 15 minutes. And then I actually went to the office because I need something a little bit more sturdy than the elastic ankle brace. And I'm actually going to use this. I'm going to use this device that's going to help keep my ankle stay upright. And if that doesn't work, yes, that means I'm actually going to go to a bigger actual walking boot. This walking boot, as you can see, is pretty heavy duty. It's balanced, and you see that cool thing about it rocking? That actually helps you walk a little bit better so you don't feel like you're walking like a duck. And what's even going to be even better, I love this. This device that we've been using for many, many years called an Even Up. So you see this diagram of this young lady without the device. You see how her shoulders, her hip, and her back is all off in her knee. And you see that she has that little device on the side, and it goes over so many different kinds of shoes. This is such a unique, great individual kind of device that works really well. So later today, when I eat, I'm going to take some anti-inflammatories again, as recommended per the label, and then continue to follow and watch for more. And day number 3 of dealing with an acute ankle sprain. So yesterday and the day before, just continued to elevate and ice behind my ankle for about 10 to 15 minutes. I went with the bulkier brace. I still am using the elastic, or I am still using this underneath for a little more stability, but since I do have to work today, I'm actually going to go a little bit bulkier. And then we have that cool device that Miss Shannon's showing us, the Even Up, that's going to go on my other foot. That's going to help to level out my shoe. And yes, I am that lazy. I'm going to have her put it on for me, okay? No shame in asking for help or assistance. You can see it goes on many, many different kinds of shoes. It goes along the outside, and then it straps over the top. Any other advice you want to give us, Miss Shannon?
Make sure you're even. There's a little insert, an extra insert in here It can raise you a little bit higher. Just make sure that this foot doesn't end up being higher than the boot. If so, take out this insert, give it a try. Make sure you're balanced. All right, this is my perspective of Dr. I's feet. With his even up and his boot, I just want to make sure he's not super crooked. How do you feel, Dr. I? Do you feel balanced?
I feel balanced.
Okay.
I know I look for the hips and see if the hips are level. If your knees are level, you don't want to feel the tilt. You don't want to feel like you're going one way too much versus the other side. You want to feel like you're walking relatively smooth and neutral.
Neutral. And if in doubt, stop. Reevaluate your feet so you're not unbalanced.